Hi everyone. The birth of a baby is always a joyous moment for most people. But these moments of joy often turn into a jumble of emotions such as fear, anxiety, and guilt, and often turn into depression. Most new mothers experience postpartum baby blues after childbirth, which involve emotions, mood swings, and anxiety. And these typically start within the first 2-3 days after delivery and last up to a few weeks. But in some cases, these form of emotions can actually become a little more severe and last up to months or years, which is known as postpartum depression. Postpartum depression is a type of depression that happens after having a baby. It affects around 15% of people, and it can be identified through emotions such as excessive guilt, excessive crying, fear, anxiety, and you reach to a portion where you're not able to take care of yourself as well as your baby. But this condition can actually be treated with the right form of medication and counseling if you identify it at the right time. Now, how to identify if you have baby blues or postpartum depression? The symptoms of postpartum depression are a little different than baby blues. Baby blues often last only up to few days or weeks, but when it comes to postpartum depression, the symptoms are a little more severe. And the symptoms are as follows. You might feel suicidal. You might not feel like taking care of your baby. You might feel like harming your baby. You might cry excessively. You might have fatigue, lack of sleep, anxiety, fear, and guilt. Now, what are the factors that increase the risk of having a postpartum depression after your childbirth? Now, if you have a personal history or a family history of having postpartum depression or depression, if you have a marital conflict, if you have limited social support, ambivalence of pregnancy wherein you're doubtful whether you want this baby or you do not want this baby, if you had health conditions during your pregnancy or during your delivery, if you are under the age of 20 and if you're a single parent, and if you have a baby with a special needs and if your baby cries a lot. Now, how is postpartum depression treated? So, postpartum depression is treated depending upon your kind of depression and the severity of depression. Usually, it is anti-anxiety or antidepressant pills, or sometimes it's psychotherapy or participation of social support groups. Here are some things that you can help yourself to cope with postpartum depression on a very personal level. You can find a therapist or anybody whom you can talk to. It could be friend, it could be family, or it could be anybody whom you confide in. You can also be a part of social support groups, especially for new parents. You have to eat healthy and take care of yourself. Make time for yourself. You can go out with your friends, go for shopping, or do anything that interests you. Get help for household chores and errands. You do not need to do it all by yourself. Can postpartum depression be prevented? Well, not just postpartum depression. Any kind of depression isn't entirely preventable, but there are few warning signs that you can look into which can help you cope and identify the depression that at its early stage. So these are some things that you can do. You have to have realistic expectations about yourself and your baby after your delivery. Limit visitors when you go home right after your delivery. Always ask for help if you need anything. You can foster your relationship with your partner. Make time for yourself and make sure you exercise and eat healthy, because a healthy mind and body can help you in a lot of ways. Thank you so much, and for more such videos, do subscribe to the channel.